Hi, it's Dr. Noel Williams, August 2nd, 2020, COVID update. This is my third time trying to do it today because I keep on saying so I'll try to do better on this one because this is it. So COVID is running rampant in the United States, as we all know. Dr. Birx went on TV today and said it's going to be everywhere and just to wear our masks and wash our hands, and she kind of threw her hands up in the air and said, "Well, I don't know," and that's kind of not what we need from one of the person heading up the task force. But I've kind of decided that the federal government response at a granular level, to use that word, well below that of the White House, is completely and totally failing, because it's kind of knowing that Pearl Harbor was about to happen and you've had 6 months to prepare for it, but we'll still all just stay in our ships and not launch any fighter planes or do anything, because we're still at a point where, even though there's starting to be more and more science giving us options to do things, the FDA, CDC, NIH are doing nothing. They're doing nothing. There's no treatment, and that's my standard complaint. There is no outpatient treatment recommendations, whether you want to talk about Plaquenil or whatever. There are tons of things to do outpatient, because once people get to the hospital, they can get really sick and they can die. And as the data came out, which I posted last week, 78% of people are having heart damage even if they stay outpatient. That's going to end up being pretty similar, I have a feeling, for kidneys, somewhat for brains, somewhat for lungs, and other organ systems, because it's a microembolic event. So there's so much inflammation with COVID that your clotting proteins start to cling together and your platelets, and so you get little clots, and they go into little places and they damage you, and that's bad. So we don't want that to happen to people. So how about doing something? Oh, but we're not going to do anything in the United States, and I'm beginning to wonder why. I used to think it was there was a huge political thing, and then I realized that was just the media, so that's probably not true. Then I was trying to figure it out, and I've kind of come to the conclusion it has to do with Big Pharma. Just because if Plaquenil is not under emergency use order, then you can use an emergency use order for a vaccine. So if Plaquenil works, and I'm going to go over some Plaquenil data showing, again, that it works, there wouldn't be the ability to fast track a vaccine that doesn't have appropriate studies. And so that's what they're going to do, is the goal, I believe. But if you look at the most recent data, first there was a New England Journal of Medicine article that came out which showed there was no difference between Plaquenil with Zithromax, or the control arm of the study. It was from Brazil. It would have been a really good study, except for the control arm patients. The vast majority of them were on Plaquenil with or without a Z-Pak before they entered the study. So basically everybody was on the same thing, and it's early use with Plaquenil to get the biggest bang for the buck. So if you get it early and then you don't get it when you get admitted to the hospital and they include you in the study as the control arm or the non-treated, you're actually treated. And lo and behold, everybody had the same results, which were better than most studies in terms of what happens to people. So that was really interesting that, one, the New England Journal of Medicine even published it. They shouldn't have. The confidence intervals were bad. The p-values were bad, sort of, but the confidence intervals were bad. But the control arm were treated with the drug we were studying. So, well, they weren't a control arm. It's a travesty, and it illustrates politics. It's disgusting. It's disgusting. I think the New England Journal of Medicine editor should be replaced. But, you know, I'm an Oklahoma gynecologist, so no one cares what I think. But it's just florid bad science. Unlike the University of Milan study, where they had 3 arms, which they treated people with either standard therapy plus Plaquenil, or standard therapy plus Plaquenil with Zithromax. And lo and behold, the arms that got the Plaquenil with Zithromax essentially had a 60% reduction in death. Surprise, the same thing being shown over and over and over now. We have this data from multiple institutions across the world, but we're just not going to believe it in the United States, even from the United States place, because it's about the vaccine emergency use order, is what I'm convinced. Plus, if you start investigating Richard Burkle a little bit more and see how he was a Gilead consultant, and the people who have been in that division at the NIH are so in bed with these people, in Big Pharma, it's disgusting. Well, the other interesting thing that was really cool was one of the, you could argue, top 3 premier cardiology centers in the United States. And this is a big shout out to all the cardiologists who occasionally perhaps don't think that Plaquenil is deadly when they've never used it and don't understand it. two of the cardiologists at Baylor, where William DeBakey pioneered cardiovascular surgery, it's considered a top 3 center in the United States, probably in the world, sent a letter asking to reverse the emergency order on Plaquenil because it's not harmful and it works. And so the interesting cardiac data. Interesting too about the New England Journal of Medicine article, they may have found that, well, there was no difference between placebo and Plaquenil in outcome, but there wasn't any problems with the heart either in the group. So once again, this whole folkloric thing that Plaquenil is super deadly to the heart at normal dosing is incorrect. It's confirmed in multiple studies. The one study again that showed that it was harmful was pulled from the thing. I can't tell where the camera is on my phone, so that's why I'm looking around. So that's just the interesting stuff. It's kind of crazy. I mean, you can't make this stuff up. We've all heard that in our lives, but COVID is the greatest single example of you can't make this stuff up. The unethical conduct, the big money, the politics, and all of that. So we just have to suffer through it. So supplements, I'm going to update the supplement list this week because I really feel like we need to start taking into account the thromboembolic events better. So I would probably, and I've been talking to a few other doctors, what's the safest thing people can do? And probably everyone being on one omega-3 a day would be great. If you're a higher risk person for blood clots, probably 2 omega-3. And then if you get COVID, you really want to be on 2. There may be some role for some blood thinners, but that would have to be through a physician, and outpatient blood thinners is a tough decision for anybody since you'd be doing your best to help people, but there'd be a million lawyers to criticize you if anything went wrong. And that's the problem with COVID, since there's no direction from the FDA, CDC, NIH. Dr. Birx running around like a chicken with her head cut off. And I'm not saying that because she's a woman or something, but that's what she was doing today. I mean, Fauci is the very calm, we don't do anything. She was more like, there's nothing to do. So, I mean, I don't know what we do about that. There is things we can do, remember. Elderberry, if you get sick, call your doctor, your nurse practitioner, your PA, see if they'll put you on hydroxychloroquine. If not, if you're starting to get worse, tell them, hey, how about an antibiotic? You got to advocate for yourselves with this. That's what we can do. So that's kind of the news of the day. Not a lot. I didn't go through a lot of the statistics because I didn't look today because it's all pretty bad. In terms of the number of cases. They're spreading into the Midwest. It's flaring everywhere. And on a final note, there's this persistent thing with Sweden that Sweden somehow did better. Sweden has done the worst of any Northern European country. Just a week and a half ago, 30 of their most prominent physicians and scientists wrote a letter to the editor, I think it was to the New York Times or somewhere, showing how they completely bombed. The head of their epidemiology section of their federal health service said they have had a terrible outcomes. I mean, they had 5,700 deaths. We don't even know how many thousands and thousands and thousands and thousands of people that got sick are going to have long-term damage in Sweden. So it's not a success story. It's a fail. They've defined it as a fail. I don't understand how Bloomberg could do an article saying it wasn't. The World Health Organization did several months ago. Their own country says it's a total disaster, so that's kind of interesting. So what can we do to finish up? Take your vitamins. Take your vitamin D. Take your zinc. Oh, our zinc study is going to be getting started, so I'll put a post on if anyone wants to fund it, because of course Big Pharma isn't going to fund our zinc study. So I'll send a little donation notification for people for that. Now keep in mind, none of that money goes to any of the physicians who are running the study. It's just to cover costs, because the data stuff's incredible to meet the requirements for the EU, even though we're not part of the EU. It's just very complicated stuff. Thankfully, there's very smart doctors involved besides me. So we'll get that study rolling, so I'll give people opportunity, if possible, to help fund it. And a big thank you for anyone who does do that, and any help counts. What other things? So wash your hands, stay positive, be kind, don't yell at people who are wearing masks who aren't wearing masks. Be of good spirit. Thank you. Bye.